Argentina has been on an extensive path to control the HIV/AIDS epidemic. Everything started 30 years ago in 1981 when the first case was reported. Since then, Argentina, alongside Brazil, has become a pioneer in the fight against HIV/AIDS in Latin America, first through the creation of the National HIV/AIDS Program in 1992, and then in 1997 through the introduction of universal and free access to antiretroviral treatment for all people living with HIV/AIDS. Universal treatment drastically and immediately reduced the epidemic and converted the AIDS program into a public policy with financial protection for the poorest and uninsured. During this period in the prevention side, the country implemented nationwide mass media campaigns to increase knowledge and a 0800 anonymous helpline. The economic crisis of 2001 had deep impacts in Argentina and in its health sector. During this time, the sustainability of HIV/AIDS treatment, the purchase of medicines, and the universal coverage of the program were in jeopardy. As a response to the crisis, the World Bank and other international agencies and donors, such as UNAIDS and the Global Fund, supported Argentina in the creation of a financial protection system for the HIV/AIDS program. This financial program system supported the new legal framework approved in 2002, which mandated health providers to offer HIV testing to pregnant women, thus expanding coverage and strengthening prevention. As part of this system in 2003, the Argentine government requested that the World Bank restructure 7 ongoing projects from different sectors to accelerate procurement and purchase of key HIV medicines and supplies. This was an opportunity to continue expanding coverage of treatment to the poorest. Additionally, the lack of a comprehensive agenda in sexual education at schools and a national sexual and reproductive health program was a barrier for reducing stigma and discrimination and improving prevention. In 2006, the country created the National Sexual Education Program, which finally incorporated sexual and reproductive health education into school programs nationwide. As a result, the Pan American Health Organization affirmed that Argentine youths now have one of the highest knowledge of HIV transmission and prevention in the region. Furthermore, since 2007, the country has reinforced the comprehensive prevention policy for HIV/AIDS by increasing the partnership with civil society and accelerating the widespread distribution of condoms. Condom distribution increased by 250% in 4 years with the installation of fixed delivery points that ensure widespread public access to prevention. To improve strategic planning, Argentina carried out 2 national provider surveys in 2007 and 2011. The comparative results show that 90% of all provincial programs improved between the first and second surveys, particularly in terms of access to preventative, diagnostic, and healthcare services for people living with HIV/AIDS. Since 2007, many innovations were introduced in the program to improve efficiency and quality of healthcare services. The World Bank financed 2 additional projects for public health, which introduced results-based financing and incentives through the use of outputs for different public health programs. In the HIV/AIDS program, the goal was to expand coverage and improve prevention and quality of treatment. Outputs-based payments could be structural, such as the installment of an HIV/AIDS testing center, or process outputs, such as the certification of a well-functioning testing center, or for achieving intermediate results, such as to increase the number of HIV tests in a facility. Moreover, both public health projects contributed towards higher efficiency of the National AIDS Program by financing an online monitoring system for logistics that helped organize shipment, conservation, and distribution of medications and supplies. They also implemented a patient case management system that allows for online registration of patients for requesting authorizations and monitoring patients' viral load. With regards to financial sustainability, while in 2002, 97% of the HIV/AIDS program was covered through external financing, in 2009, Only 1% of total funds came from external sources. In the prevention side, the last few years have been fruitful to reduce stigma and discrimination, with the approval of the Marriage Equality Law in 2010 and the Gender Identity Law in 2013. Because of all these policies, Argentina has become a regional leader in the reduction of morbidity and mortality due to HIV/AIDS. In fact, in the last decade alone, the country reduced its HIV burden by 21%. Since 2010, Argentina has had the second lowest HIV/AIDS morbidity and mortality in South America after Chile. The country had only 2.9% of the total regional HIV/AIDS burden of disease measured in disability-adjusted life years, known as DALYs. This burden is low in contrast to other countries with similar GDP and population size, such as Colombia, which has 15% of the total Latin American burden. Also, between 2000 and 2010, there was a 25% decline in HIV incidence and a 62% decline in vertical transmission. Despite all these successes, there are still current and upcoming challenges that must be addressed. First, the country should work to reduce subnational disparities. The HIV burden is highly concentrated in urban areas, with a variation between provinces that ranges from 12 to 444 DALYs per 100,000 people. As a second challenge, it is extremely important to reinforce focused prevention and treatment efforts and to target better specific high-risk populations such as young men who have sex with men, transgender people, sex workers, pregnant women, and tuberculosis patients. As a third challenge, the treatment of patients in health facilities should be improved to continue reducing stigma against population at risk. In terms of efficient allocation, the fourth challenge for Argentina should be to reduce the cost of the medicines for the program. Expenditures per DALY in Argentina were the third highest in the region after Cuba and Chile in 2009 to 2011. For solving this, strategic procurement could be a potential response. In summary, the balance is very positive, and the path of these 30 years of HIV/AIDS epidemics in Argentina shows some important lessons for the region and worldwide. 1. Provide opportune universal access to HIV/AIDS treatment with financial protection for the poorest is key for reducing the epidemic. Argentina achieved 81% of coverage for treatment, considered as universal coverage by the World Health Organization. 2. The government and the civil society were proactive and took the lead to improve human rights related to sexual and reproductive health, advocating for laws and creating a legal virtuous circle in favor of the country. 3. Argentina was proactive for health services planning based on needs, using surveys in health facilities, modernizing follow-up of patients with technology, and using incentives and results-based financing in the health delivery model for improving quality on delivery and efficiency. 4. The country built a strong commitment with the civil society in the education sector. 5. Long-term alliance between Ministry of Health and Ministry of Economy for ensuring opportune intervention and sustainability of an efficient program to protect the poorest. The cost-benefit study performed by the World Bank showed that Argentina saved over $748 million from 2001 to 2010 by implementing a comprehensive HIV/AIDS program. Moreover, it has averted 4,379 lives in 10 years, approximately 440 lives per year in a conservative scenario. In terms of incidence, this means while in 2004, 18.5 persons became infected with HIV per day. In 2013, less than 15 people get infected every day. In this next decade, Argentina is on the road to eliminate vertical transmission, increase prevention, and ensure universal coverage and financial sustainability of the HIV/AIDS program. There are at least 4,379 reasons to continue on this successful road.